Okay, welcome to today's session. In today's session, we are looking at post-operative care. So having looked at pre-op elective, pre-op emergence, we need to also look at the post-operative care. So we'll go straight into the session for today. In terms of post-operative care, we will look at the following outline. The post-operative care, you need to look at the aims. From there, you talk about patient collection, the environment, promoting a patent airway. You talk about promoting adequate breathing, promoting adequate circulation, care of drainage tubes, observations. Then from there, of course, you talk about the pain management, psychological care, nutrition, wound care, exercise, hygiene, and the last heading is elimination. So we'll go straight to look at the details of this particular management. The first point, of course, you talk about the aims. In terms of the aims, you can say to ensure normal cardiovascular and respiratory functioning. Apart from that, you can say to closely monitor the patient for complications such as hemorrhage. Of course, this can come as point number 4. And you can talk of to relieve incisional pain and also, of course, to maintain adequate nutrition. So these are some of the aims you can use. Even in no matter the type of post-op that you are given, these aims will still apply. From there, the first heading is patient collection. And if you remember when we were doing pre-operative care, we ended on where the patient has been taken to theater, meaning that post-op, we are talking about now collecting this patient of ours. So in terms of points, you can talk about once the patient is ready for collection from theater, you say I will go with to pick the patient with a post-operative tray. When you look at the post-operative tray, it has gauze swabs which are used for wiping secretions, examination gloves when handling any body fluids from the patient, the oropharyngeal airway to maintain the tongue in position, also a tongue depressor, and also an emesis buoy in case the patient wants to vomit. So those are the things that are contained on the post-operative tray. Now, when you look at the post-operative tray, it does not have any TPR instruments because we depend on the findings or the handover that will be given from theater. Hence, before receiving the patient, you talk about ensuring that the patient is breathing by observing the rising and falling of the chest. Apart from that, you can feel for warm air coming out of the nostrils. That also ensures that the patient is breathing. You can talk about getting a detailed handover as well from theater nurses about the anesthesia, the surgery, how did it go, fluid and blood loss, including replacement, and the type of analgesics that should be given. So all that information should be gotten during handover. Apart from that, you can talk about when transferring the patient to the ward. You can use the patient trolley, of course, and the patient positioned in recumbent position with the head turned to one side. So on patient collection, these are some of the points that you can put there. The next heading is environment. On environment, of course, you talk about nursing the patient in the acute bay. Of course, even if they're in the post-operative phase, you nurse them in the acute bay because they still have the effects of anesthesia. You can talk about ensuring that the environment is warm enough to prevent hypothermia because during intraoperative phase, the patient was in theater, which is a cold environment. Hence, we need to restore homeostasis by nursing them in the warm environment. The environment should have adequate ventilation and, of course, a quiet environment as well. This will help the patient rest from the stress of surgery. From environment, the next heading is promoting a patent airway. The reason we are promoting the ABCs is because the patient was on general anesthetic drugs and they are unconscious. and hence they will need to recover from the effects of anesthesia where the ABCs are restored. So you can talk about nursing the patient in recumbent position with the head turned to one side for drainage of secretions. Of course, you can talk about hyperextending the head to facilitate free entry of air in the lungs. You can maintain this position until the patient is fully recovered. That's when you can nurse them in semi-fowlers to promote full lung expansion. You can talk about suctioning to prevent aspiration of fluids. And of course, you can insert an oropharyngeal airway to prevent the tongue from falling back and blocking the airway. These and many other points can still apply on the airway. The next heading is breathing, and on breathing you of course assess the adequacy of breathing by checking the respiratory rate, observing presence of cyanosis, and doing a pulse oximetry test to determine oxygen saturation. You can talk about, of course, you can talk about administering supplemental oxygen, and in adults we are giving 3 to 5 liters with the exception of 10 liters in severe cases to promote tissue perfusion. And of course you can give oxygen using a nasal catheter still, and this will still promote tissue perfusion. The next heading is promoting adequate circulation. On circulation, we are checking on the fluids and blood in the patient's body. And of course, on circulation, you can talk of assessing circulation as well by doing a capillary refill test, checking the skin color as well as the incisional site for fresh bleeding. Apart from that, you can talk about ensuring that the intravenous line is patterned for continuous infusion and that fluids are running at the correct rate to prevent fluid overload or under hydration. And of course, from there, the next heading is care of the drainage tubes. The patient coming from theater, they may have different drainage tubes, including IV lines that are set up. Hence, we need to care for them. So you can talk about, of course, checking the file for the doctor's order for specific treatment for example, in terms of oxygen, intravenous infusion, appropriate drainage system, especially in chest conditions, and special positioning and observation. Apart from that, you can unclamp the drainage tubes, because if they are not quickly unclamped, they may become blocked and sufficient pressure may build up in the abdominal cavities. From care of the drainage tubes, the next heading is observation. As usual, on observation, you check the temperature, pulse, respiration, and blood pressure. Apart from that, assess the level of consciousness in the patient, and you mention the time frame that these observations will be done. For example, you do them every 15 minutes for the first 1 hour, then every 30 minutes for the next 2 hours, then progress to hourly for the next 2 hours, and then if the patient is stable, you do 4 hourly until full recovery or when the patient is discharged. You can observe the intravenous lines as well for patency. You can observe fluid input and output as well. You can observe the surgical site for bleeding or drainage. And so all those points can still be applied on observation. From observation, the next heading is pain management. On pain management, you can talk about assessing the level of pain and of course the pain characteristic, and this helps know the interventions to put in place. Positioning the patient in a comfortable position, this will reduce pain against the incisional site. You can talk about administering narcotic analgesics like pethidine, 50 to 100 milligrams, 6 to 8 hourly. This will reduce pain. And of course, you can now give paracetamol 1000 milligrams until the patient is able to tolerate pain or until the pain clears, because narcotics or opioids, they can cause addiction. And of course, you can talk about using diversional therapy, and diversional therapy will help divert the patient's mind from concentrating on the pain. From there, of course, the next heading is psychological care. On psychological care, you say, of course, once the patient is fully awake, you can explain the measures put in place to relieve pain. You can talk about explaining the significance of the tubes that the patient has come with from theater to prevent unnecessary anxiety. You can, of course, allow family members to visit. This will provide emotional support. You can, of course, explain the post-operative expectations to the patient as well, and of course, allow the patient to express their fears and concerns. So these points and many others can still be applied on psychological care. There are many points like explaining procedures being done on the patient, involving relatives or significant others in the care. All those points are still valid on psychological care. From there, the next heading is nutrition. On nutrition, you talk about, of course, ensuring that the patient is on neo per oral until bowel sounds are heard. Apart from that, when bowel sounds are heard, you can talk about giving sips of clear fluids to assess the swallowing reflex. Apart from that, you can talk about removing the nasogastric tube and allow the patient to take fluids freely, so that apart from fluids, you see how the patient is able to tolerate fluids. Then you move to diets gradually, such as from liquid to solid foods, then to more solid foods. Apart from that, you just ensure that the patient is eating nutritious meals, and you can give examples of nutritious meals that is being given and examples of foods as well. From nutrition, the next heading is wound care. This patient has an incision, has a wound caused from incision, so you need to care for that particular wound. And in this particular case, you can talk about inspecting the wound for bleeding, tightness, and also the bandage to assess the nature of drainage and the amount of the drain tube as well. You can also talk about cleaning the wound daily and dress the wound using aseptic techniques. You can talk about gently washing the skin around the incision. This will promote or prevent infections, and of course dressing the wound with a dry and clean dressing to prevent contamination on the incision. So all these points can be talked about on wound care. From wound care, the next heading is exercise, and on exercise you can say during the immediate post-operative period, the patient will be on complete bed rest. You want this patient to recover from the stress of surgery. Apart from that, you talk about performing passive exercises. This will improve muscle blood supply and prevent muscle wasting. You can talk about encouraging the patient to do deep breathing exercises. This will prevent respiratory complications. You can talk about encouraging the patient to walk out of the bed and move around. This will prevent deep vein thrombosis and just promote limb exercises. So on exercises, it is very important as part of the recovery process in this manner. From there, we talk about hygiene. In terms of hygiene, you can talk about attending to the patient's personal and environmental hygiene to promote the patient's condition. You can, of course, talk about bathing the patient, hair care, nail care. All those points can be put under hygiene. And the last heading is, of course, elimination. On elimination, you monitor the elimination pattern. You want to detect any abnormalities such as reduced urine output, diarrhea, or constipation. Talk about observing bowel opening to rule out intestinal obstruction. You talk about if the patient is vomiting, you provide an MSCC board so that the patient can use it during vomiting. So basically, in terms of the management, post-operative care, this is the outline and these are the details. So for now, this is where we'll end. We'll continue, of course, with questions now related to surgical conditions.